Today, we're going to pull back the curtain and go inside the operating room for a step-by-step look at a thyroidectomy. Now, this is one of modern medicine's most common procedures, for sure, but it's also one of the most delicate. We're going to explore exactly what it takes to navigate this really intricate surgery, from the very first incision to the final stitch.
You know, thousands of people have this procedure, but have you ever wondered what really happens after you're wheeled into the OR? How does a surgeon actually navigate the incredibly complex landscape of the human neck to safely remove this vital gland? Well, that's the big question we're diving into today.
All right, so here's our game plan. We've got 5 parts to our journey. We'll start in what I like to call the body's engine room to meet the thyroid itself. Then we'll go right inside the operating room to see how the procedure unfolds. We'll get into the really tricky part, navigating the critical structures, before taking a look at the risks, the recovery, and what life looks like after it's all said and done.
Okay, first things first. Before we can even begin to understand the surgery, we've got to get oriented. We need to know the surgical site and, of course, the star of our show, the thyroid gland.
So check this out. This little butterfly-shaped gland, sitting right at the front of the neck, that's the thyroid. It's basically the body's engine room, right? It regulates our metabolism. And what you're seeing here, that's the surgeon's eye view. This is the intricate landscape where this entire delicate procedure is about to unfold.
And now for the main event. We are heading into the operating room to break down the core sequence of a thyroidectomy, step by step.
You know, this whole thing isn't just random. The operation follows this really clear and logical workflow. It goes from the initial cut all the way to the final closure. Every single step is methodical, building on the one before it, and precision is absolutely everything.
Okay, so the first crucial move is just getting access. A surgeon makes a very careful incision to create what's called a subplatysmal flap. That's a thin layer of tissue right under the skin. Then they gently part the strap muscles, those vertical muscles at the front of your neck, right down the middle. This maneuver literally opens the window, giving them a clear, direct view of the thyroid.
So, once the thyroid is exposed, the next move is to gently pull one of the lobes towards the center of the body. Now, this slight retraction might seem small, but it's critical because it brings the middle thyroid vein right into view. And dealing with this vein is one of the first major steps in isolating the gland from its blood supply. And this is where things get really interesting. It's all about this delicate dance at both ends of the gland. At the top, the superior pole, the surgeon divides the main artery while being incredibly careful not to touch the superior laryngeal nerve. Then, down at the bottom, the inferior pole, they do the exact same thing with another artery, but this time they're protecting the super important recurrent laryngeal nerve. It's like a mirror image of precision.
All this talk about precision brings us to what is, without a doubt, the most demanding part of the whole surgery: navigating a dense map of nerves and glands where a single millimeter can make all the difference in the world.
And wow, this image just says it all, doesn't it? I mean, look at how crowded this space is. You've got the thyroid itself, you've got the artery feeding it blood, you've got these tiny little parathyroid glands that regulate calcium, and running right through all of it is the recurrent laryngeal nerve, the RLN. That's the nerve that controls your vocal cords.
So with all that going on, how in the world do you protect something so small and so vital? Well, the answer, and this is the absolute gold standard in thyroid surgery, is you have to see it. Surgeons don't just guess or work around where they think the nerve might be. They meticulously dissect the area until they have a direct visual confirmation. It is paramount. And finding this nerve, it is not guesswork. Surgeons use this incredibly precise map of anatomical landmarks. For example, there's a tiny projection of the thyroid called the tubercle of Zuckerkandl, and it's a key signpost because it reliably points right toward the nerve. By systematically following these markers, like the groove between the trachea and esophagus, they can confidently zero in on it. It's kind of like navigating by familiar stars. Okay, so the gland is out. The surgery's complete. But the patient's journey is far from over. Now the focus shifts completely to recovery and managing the potential risks that come with such a delicate operation.
And it probably won't surprise you that the biggest risks are tied directly to that super crowded anatomy we were just looking at. If that recurrent laryngeal nerve gets injured, for instance, it can lead to hoarseness. If the nearby parathyroid glands get disturbed, that can cause a drop in calcium levels, which is a condition called hypocalcemia. And of course, like any surgery, there's always a risk of bleeding.
Let's just zoom in on that one term for a second, hypocalcemia.
So those tiny parathyroid glands that control the body's calcium, they sit right on the back of the thyroid. During surgery, they can sometimes get a little stunned or even accidentally removed. When that happens, blood calcium levels can dip too low, and that's exactly why they're monitored so closely in the hours and days after the procedure. So that first day or so after surgery is all about careful, vigilant monitoring and support. This means checking vitals all the time, and crucially, checking those calcium levels every 6 hours. It also means slowly reintroducing food, managing any pain, and encouraging the patient to get up and moving to help with recovery. And one really important safety measure, because of where the surgery is to always have an intubation set on standby, just in case there's any swelling that might affect the airway.
All right, we're in the home stretch now. Let's talk about the final steps in the hospital and what life actually looks like long-term after a thyroidectomy. So before a patient can actually head home, there are a couple of final boxes to check. They have to be eating normally, of course, but the most important thing is setting up their thyroid hormone replacement. See, since the body's little hormone factory is gone, a daily pill is needed to take over that vital function for the rest of their life. Then, a follow-up blood test about 6 weeks later makes sure that the dose is perfectly dialed in for them.
You know, this really brings it all home. Safe and effective thyroid surgery isn't just about what's in a textbook. It's about skill that has been refined over thousands and thousands of hours. That old saying, practice makes the master, it is so true here. It's that dedication, that mastery of this delicate anatomy that allows a surgeon to perform this procedure safely time and time again.
So what a journey, right? We've gone from the basic anatomy of the thyroid gland to the incredibly fine-tuned steps of its removal and the road to recovery. And it leaves us with one final thought to ponder. As our techniques and our tools get even more refined, what's next? What new possibilities might emerge that could make procedures like this even safer and less invasive for patients in the future?